The whole world was in the midst of an obesity epidemic even before we were faced with a pandemic. I am going to discuss the relationship between diet induced obesity and COVID 19. Obese people who contract COVID 19 generally end up faring far worse than people who are within a healthy weight range. There are multiple factors that contribute to the reason why. First, we need to discuss how this virus runs its course. The virus is spread person to person through respiratory droplets from an infected person's cough, sneeze, or droplets produced from talking. The droplets are inhaled into the nose or mouth of another person and from there enter into their respiratory system. In mild cases, the immune system is able to kill off the virus before it reaches the lower respiratory system. In more severe cases, the virus moves to the alveoli of the lower lobes of the lungs, where it can begin its attack. Alveoli contain type 1 and type 2 pneumocytes. The type 1 pneumocytes are responsible for gas exchange within the lungs. The virus targets type 2 pneumocytes. Type 2 pneumocytes' job in the alveoli is to produce surfactant, which is responsible for decreasing surface tension and preventing the collapse of the alveoli. The red projections on the outside of the virus are called spike proteins, and they are what latch onto the type 2 pneumocytes. Once attached to the pneumocyte, the virus gains access to the cell in order to replicate the different components of the virus, and the cell is no longer able to maintain itself. The damaged cell releases inflammatory chemicals. The chemicals secreted signal the macrophage, which is on the interior of the alveoli. In response, the macrophage releases cytokines, which are signaling proteins. The cytokines enter the bloodstream and cause dilation and increased permeability of blood vessels and capillaries. This allows plasma to leak into interstitial space and inside the alveoli. Fluid inside and outside results in alveolar edema and the surfactant is drowned out. The surface tension increases, there is decreased gas exchange, and the alveoli collapses. The infected person will end up having to work harder to breathe. They will also have hypoxemia, which is low arterial oxygen saturation, as the alveolus are attempting to reopen against the fluid. If this process continues, a person can potentially end up in acute respiratory distress. ARDS symptoms include blue-tinged lips or nails from lack of oxygen in the blood, confusion, dizziness, sweating, fast and labored breathing, general weakness, fatigue, and low blood pressure. Neutrophils are signaled by the chemicals secreted by the damaged type 2 cells and they come to destroy the virus. Damage is sustained to the type 1 and type 2 cells. Dead cell debris and fluid collected inside the alveoli alters gas exchange. A productive cough is developed to try to force out the consolidation of debris and fluid in the alveoli. The alveoli release chemicals which cause the hypothalamus to reset the body's temperature higher to a fever. The sympathetic nervous system is stimulated to cause an increase in heart rate and a higher rate of respirations. All this inflammation can spread system-wide, which is when the sickness gets even more serious and leads to SIRS. SIRS stands for Systemic Inflammatory Response Syndrome. Being overweight is defined as one's basal metabolic rate being in the range from 25 to 30. Obesity is defined as BMI over 30. Hormones, genes, gut bacteria, diet, and physical activity are some of the different factors that can determine someone's body weight. A small study was conducted in a hospital in Italy with 100 patients. 29 were obese, 71 were of normal weight. They had similar age, gender, and comorbidities. The only difference was the majority of the obese patients had hypertension. Over the duration of the patient's hospital stay, the obese group required higher levels of oxygen, a longer amount of time to wean off the oxygen, as well as a longer hospital stay. Interestingly, they also yielded COVID positive swabs for a longer period of time, which translates to shedding the virus longer. A large obese population prolongs virus shedding throughout the total population and results in a more virulent virus strain. Obesity is known to be associated with decreased lung function and poor response to mechanical ventilation. More fatty tissue surrounds the larynx and pharynx, with results in more difficult intubation. Also, they frequently suffer from cardiovascular dysfunction, hypertension, and type 2 diabetes. When a body is overweight or obese, immunity is impaired, blood is more prone to clotting, and cells are in a state of chronic inflammation. With impaired immunity, the inflammatory response is accelerated. Because of the stigma surrounding being overweight, people may feel apprehensive to seek medical care. The availability of special equipment overweight patients require, such as specialty beds and positioning equipment, may be limited or unavailable. Quarantine has led to an interruption of everyday life and perhaps job loss, coupled with increased stress, anxiety, and boredom with having to stay home. People sometimes use food as a way to cope with stress. People eat because they are bored. Food can serve as a comfort. All these scenarios can result in overeating. Being obese puts people at risk for developing heart disease, lung disease, and diabetes. Tryptophan, which is found in foods such as milk products and turkey, can help regulate satiety and caloric intake. Milk and yogurt can also enhance natural killer cell activity, which can reduce the risk of respiratory infections. Although obese people often have increased intake of calories along with macronutrients, malnutrition and micronutrient deficiency can still occur. Micronutrient deficiency is linked to impaired immune response, which can make people more susceptible to viral infections. Several studies have concluded fruits and vegetables that supply micronutrients can boost immune function. Vitamin E, C, and beta carotene are antioxidant vitamins. They offer protection to cells. Dietary sources of vitamin E are vegetable oils, spinach, nuts, and seeds. Foods that contain vitamin C are red peppers, strawberries, oranges, mangoes, and broccoli. Beta carotene is found in sweet potatoes, carrots, and leafy green vegetables. Another unhealthy side effect of quarantine has been more time spent indoors. This translates to less vitamin D intake from sun exposure. Vitamin D must be taken in from the diet instead. Examples of vitamin D food sources include fish, liver, egg yolks, and milk. Another beneficial mineral is zinc. Zinc can inhibit RNA binding in coronavirus. Oysters are high in zinc, but other sources include pumpkin seeds, red meat, beans, and lentils. Another way to ward off excess weight is routine physical exercise. Exercise can strengthen the immune system. Strenuous exercise, when the body is not used to it, can temporarily suppress the immune system, but routine exercise is beneficial to the body. Even a modest amount of weight loss can improve metabolic health. In conclusion, in more cases than not, obesity can be prevented or reduced in order to maintain a healthier lifestyle and hopefully improve outcomes in sickness. Thank you for watching.